Dr. Jonathan Mochel is a doctor of osteopathic medicine with Avera in Brookings, and he says gout is a severe reaction to uric crystals that deposit in joints and soft tissues.
So we all know there's sodium in our body. There's also uric acid in our body. Some amount is normal, and that comes from breakdown of body products or breakdown of things that we eat. But if due to our genetics or a kidney disease, we cannot get rid of as much uric acid as we need to, that can build up and then cause the crystallization or the formation of those crystals in your joints.
What makes this disease easy to identify are the symptoms, and Dr. Mochel says you will know when you have gout.
You'll see a sudden onset of redness and pain in your joint. Most often the middle joints of the first big toe or on the side of your foot, but also ankles and knees at times.
Dr. Mochel says anybody can develop gout, but some are more at risk than others.
Having gout in your family or a genetic predisposition can put you at risk. Men are more at risk, and people with kidney disease are also more at risk.
Gout is very similar to arthritis with joint pain, but the difference comes back to the crystals.
So it's similar in that there's pain and there's inflammation, but the inflammation is triggered by the crystal deposit rather than inflammation that comes from chronic damage to the joint over time.
Another unique feature about gout is rather than mild, constant pain with arthritis, gout comes in flares.
Arthritis might be a mild to moderate level of pain that you feel most days out of the month. Gout is severe pain that you have for a shorter span, maybe 1 to 2 weeks, and only have that a few times a year or less.
Dr. Mochel says there are some things people with gout can do to help decrease flares.
That could be being active or exercising, limiting alcohol, avoiding foods that cause elevated uric acid or high purine-rich foods, and then generally eating a balanced or healthy diet.
He also wants to mention it is nobody's fault when gout appears, as people with high uric acid don't get gout flares, and yet others with normal levels do.
Gout happens when it happens, and the best treatment to mitigate gout flares or to decrease their recurrence is to use medication to keep uric acid in a lower or normal level.